Hello, my name is Caitlin Gross, and today we will be talking about hazards in nursing. There are many different types of hazards in nursing, but one way to protect nursing staff and patients is with the use of personal protective equipment, or PPE. PPE has evolved with our knowledge of the medical field, with new diseases and new germs being discovered. PPE is changing to better protect staff and patients. But are some of these PPE able to protect the nursing staff and patients properly? Some types of PPE include gowns, gloves. Gloves are the basic PPE that should be worn all the time with patient contact. Masks. The mask on the left is an N95 filter respirator. These masks can be used with precautions like droplet precautions, or many other different things. The picture on the bottom right hand corner is a disposable respirator. Disposable respirators are used in hospitals and mainly used in the operating room. Eye protection is another form of PPE. The picture on the left is a mask with a face shield. This person is more than likely going into the operating room and needs both PPEs, eye protection, and a mask. This would be efficient to cover both those PPE needs. Picture on the right is a picture of goggles. These can also be used in the OR. So what happens when this PPE fails? When this PPE fails, it puts nursing staff and patients more at risk to catching certain diseases or germs or transmitting them one to another. And this can also negatively impact the community. Some gowns, like the one pictured, are paper thin and porous. As you can see, this gown is very transparent. And speaking from personal experience, one would wear this gown when there is a risk of bodily fluids coming in contact with bodily fluids. But if bodily fluids do get on you and you are wearing this gown, it will seep right through this gown and get directly on your skin, on your scrubs, or whatever may be underneath. So what should gowns be made out of? Gowns should be made out of any material that is more durable and less porous, like the cotton gown shown on this slide. This person is probably in the OR. These more durable cotton gowns are used mainly in the ER because it takes more bodily fluids to penetrate the gown itself and come in contact with the nursing staff. So why can't all gowns be made out of this material? Well, they can, but I'm sure there are questions with all gowns being changed to this material. So what are your questions? Well, what happens when these gowns are soiled? When these gowns are visibly soiled, staff will take off the gown following proper protocol and procedure and place the gown in a biohazard bag to be thrown away with the biohazard trash. If the gown is not visibly soiled, the gown can then be placed in a laundry bag and be shipped off for washing, drying, and sterilizing in a commercial washing machine. This may sound like the chance of transmission is higher, but this is also how hospital sheets are cleaned. They are collected, washed and dried in a commercial washer and dryer, and sterilized and reused from patient to patient. How could changing the material some PPE is made out of be beneficial to nursing staff and the community? By changing the gowns to a more durable material, this could stop the transmission from staff to patient, which could also then protect the staff's family and the patient's family. For example, if nursing staff comes in contact with bodily fluids while wearing the yellow gown and does not know they are infected or came in contact with the germ or disease, they could then go home. They might shower and change clothes, but the germ or disease could still be on them or in them. They could then transfer it to their child or their spouse, and their child and their spouse could then spread it to the people they work with or go to school with. So, changing the material that the gowns are made out of would break the chain of infection. Step 1 in the chain of infection is the germ has a source. Step 2 is the germ spreads from the source. Step 3 is the germ infects another person. In summary, there are many different types of PPE. Some PPE needs to be made out of better material. The yellow PPE gown was specifically mentioned in this PowerPoint. This will not only protect nursing staff, but also others out in the community. This change could decrease the person-to-person infection rate by breaking the chain of infection. So please, be the positive change. Let's come together and make this change for you, for me, and for our community. Thank you.